Good morning. My name is Hassan Gedi Santur. I work with the EU, and I would like to all welcome to this Facebook live handover ceremony at COVID-19 emergency response that is supporting communities and health workers in Somaliland. The handover is part of a final phase of a project called Enhancing Durable Solutions for and Reintegration of Displacement Affected Communities in Somaliland. The project is funded by the European Union and is implemented by World Vision International. To tell us more about this project, please welcome Tobias Oloo. He is Operations Director for World International Vision in Somaliland. Thank you, Simon.
Thank you very much. Now, this project, thank you, the ambassador. Thank you, the representative from Somaliland. I'm honored this morning to participate in this handover process. As I said, I'm representing Simon Nyabweng, who is the country director for World Vision in Somaliland. Simon has had an emergency this morning, and he is not able to be with us this morning. Otherwise, he would have been here to talk on behalf of World Vision. Now, this project is called Wanadir, and it tries to enhance durable solutions for the integration of the displaced affected communities in Somaliland. This project has been implemented for the last 3 years, and it was funded by the EU. Now, a number of agencies were involved in implementing this project. That included ANRC, Concern Worldwide, DRC, and we also had a national organization called TACULO, which was also part of this project. The project budget was euros 4,444,444. And we worked closely with the ministries in Somaliland. That is the Ministry of Planning, which was actually the lead ministry in this implementation of this project. We also had the Ministry of Health. We also had the Ministry of Employment and Social Affairs, and also the National Displacement and Refugee Agency. And these were ministries who are really in charge at the country level. The project targeted a population of 63,917 people, and with it, there were displaced and affected people. We also had IDPs and communities in Hargeisa and Burao. It was targeting men, women, and children. Now, as I said, this project has implemented over 3 years, and the project worked towards increasing access to basic services and creating realistic livelihood opportunities in the main access areas of return and departure in Somaliland. Among others, this was undertaken together with the key government line ministries, including Ministry of Planning, Ministry of Education, Ministry of Health, Ministry of National Displacement and Refugee Council, Refugees and Rehabilitation and Reconstruction, and local authorities, among other members. Now, the risk of COVID is spreading in the country and remains high in the agenda of the organization and other development agencies. It remains high mainly because of poor living conditions in the urban centers, especially with 2.6 million people internally displaced persons living in overcrowded sites with inadequate water and sanitation. To address these concerns, it is critical for all actors to take an integrated approach that prioritizes the needs and rights of children, especially those most vulnerable, and mitigates the long-term impact of this pandemic. Health systems are overwhelmed by this epidemic. Children and other vulnerable groups will have less or sometimes no access to other routine but critical primary and tertiary health care services if the number continues to increase. We are grateful for the continued support of the European Union in giving and continue to support collaboration with the government to reach more vulnerable people. Now, in terms of the things that we are buying for this project through the support of the EU, we have liquid antibacterial soap, we have hand sanitizers, we have goggles, eye protections, face shields, we have clean gloves, we have masks, we have single-use disposable gowns with long sleeves and reinforced sleeves, we have sodium hypochlorite solution, heavy-duty latex gloves, and knapsack sprayers with 20 liters capacity. Now, going back to the project, these were the main achievements of this project. One, we increased community engagement through community representation in IDP settlements, where we dealt with 670 people. Over 84% of the beneficiaries feel confidence to voice their concern and engage in advocacy, and compared only with 24% who reported at the beginning of the project. We conducted training of 245 healthcare workers and provision of medical services in 7 health facilities. 165 health workers were trained on GBV, case management, and 278 duty bearers trained on prevention of violence against violence and GBV. Self-help groups were established or strengthened and serving mostly youth and women. We trained 60 TVET teachers, 3 TVET centers were reestablished with 402 students graduating. And we also had training for local government counterparts on durable solutions. So, yeah, basically that in terms of the achievement of this project. Thank you very much.
Thank you so much, Tobias, for telling us about the project. And now I would like to welcome Ambassador Berlanga. He's the EU ambassador. Ambassador Berlanga, go ahead.
Thank you. Thank you very much, Hassan, and good morning, first of all, to the minister, and thank you for joining us in this humble ceremony. Thank you also for the colleagues from the World Vision, Tobias and Simon. So for us, it is very important, this ceremony. We know, I mean, when COVID started, we knew that the path to fight COVID was not going to be easy. And sometimes we are all looking for big events, big contributions, but we forget that the great difficulty in this kind of situation is really to reach the people, to reach the normal citizens that are sometimes out of the capital, and they need assistance as well to fight the COVID. And I'm very happy. Before my last visit to Hargeisa, I had the opportunity to participate in the workshop that was closing down this project run by a consortium led by World Vision. And I had the opportunity to exchange with some of the beneficiaries, to exchange with some of the with the NGOs, the local NGOs that were involved in the project. And I remember exchanging with the ladies from Burao, talking about their work and the situation there. And so I'm very happy that World Vision had the reflex to adapt the final part of the project to provide equipment and to continue support this with a small effort, but continue support the efforts coming from the government of Somaliland. We are all behind at this moment. We are all behind the authorities and the institutions, and I would like to reiterate the message that the citizens, the population should follow instruction from authorities. I mean, COVID is not over. Sometimes we have adapted to live with COVID very well, but it does not mean that it is over. It means that we need to continue our efforts and sustain them in the time. Minister, you know very well, you know how the EU tries always to be a bridge and facilitate not only in terms of equipment or in terms of assistance, but also in terms of connecting all the dots to make sure that you have the means to fight COVID. And so this is what I wanted to reiterate this morning. This is only a small contribution to a more comprehensive and long-term engagement with you in the fight against COVID, and also in all the works that you are doing in favor of creating a reliable public health service in Somaliland. Thank you very much.
Oh, thank you so much, Ambassador Berlanga, for those very important words. And now I would like to welcome, for some closing remarks, please welcome Somaliland Minister of Health and Development, His Honorable Omer Ali Abdillahi.
Oh, thank you very much. Thank you all for getting the time to acknowledge our national efforts in fighting COVID-19. I also want to thank Ambassador Nicolas and Tobias for joining this virtual ceremony in which they are handing over some emergency supplies that will help in our efforts and fight against COVID-19 in 7 health facilities in Pro. This shows that this virtual handover ceremony shows that we are all committed to join hands in terms of giving technical assistance, in terms of giving encouragement, in terms of putting all efforts so that everyone is safe and everyone gets their right to be protected against this global pandemic. I am also confident that the EU will, as it did in the past, will continue to support Somaliland in all fronts. You know, everybody knows that this disease has not only affected the health states of people, it also affected the economy, it affected the social structure and social issues, it affected many different aspects of our life. So we will, I will say that the EU has always been with us in different situations, and that EU will continue doing the same in this specific hard time. So the Ministry of Health has started from the day go to put plans at the ministerial level. Then through president appointed committee, we have been working hard and putting all plans, strategies, efforts, so that we will maximize our efforts in fighting this COVID-19. And this also shows that the government has established different funds. For the one fund for COVID-19, funding specifically the health part of the intervention. It's also developed a business fund where small businesses that will be affected by this disease will be supported, and also it's established another fund for poor people who will be affected by this pandemic. To put all this into one action, we have, as a ministry, developed what we call national response plan, a costed plan that is 15 million, and we share that with everyone, including the EU. And actually, we hope that you are working on it, looking into the 6 different strategic pillars that it contains, and your support will be along that strategic document. In terms of the economic and the social impact, also, the Ministry of Finance also put together a document, another document that costed like 110 million, that will also look into the other aspects of the impact. And also the same document has been shared widely. And actually, we also hope that the ambassador has a copy of both documents, and that your assistance will be based on these different documents. Having said that, on behalf of the Ministry of Health, I would, and on behalf of the government of Somaliland, I would like to acknowledge your personal commitment and efforts, not only looking into the big picture and looking into these strategic documents, but also having a continuous communication with us, asking us what the ministry needs, whether it is a technical, a logistical, or the financial, or sometimes a communication issue, and that actually did a lot. I want to specifically highlight that as ambassador, you have had the privilege to communicate with us, asking us what exactly emergencies we are having, and we hope that through your support, the donation from the Habshir will come through the EU flight. So that's one of the things I want to highlight. So putting all this together, this SDSC, Somaliland Durable Solutions Consortium project, has been targeting different aspects of interventions. The most important one was that it was helping our health facilities to provide quality services, and now putting some money for the health facilities that is used to support, so that our health staff are protected by giving them PPEs, personal protective equipment, by giving them disinfectants. I think that will help our first line staff who are risking themselves to save lives. That will help them, and also it will help everyone in that specific communities to be safe from this pandemic. So we hope, as we have been discussing many times, that through reprogramming of the project and through putting some extra efforts to bring new support and also continue new support, that will actually have a big impact on our efforts of making sure that everyone is safe. And I hope this spirit will continue. And at this critical moment, we also think that politics should not prevail. What should prevail is solidarity, coming together, putting all efforts together so that this global pandemic is over and we are safe. And we thank you for that, and we appreciate. And I officially announce that as a minister, you have virtually handed these supplies over to me, and I accept it. So thank you very much.
Thank you.
Okay, great. Thank you so much, everyone, for joining us for this Facebook Live event. If no one else has anything to add, either the minister or the ambassador or Tobias, anyone like to add anything to what was said?
Well, let me just following the words from the minister. I think he mentioned something, Minister, you mentioned something which is very important. It means we may observe in the next days or the next weeks how COVID cases will recede, will diminish, will decrease. But it doesn't mean that COVID will be over. It means that probably in the same way that that you are fighting cholera or polio or other diseases, COVID will be there, will be present in your societies. And then you mentioned something which is very important, which is that from an emergency, it will become a kind of public health challenge, and combined with other challenges that you have. So please know that we are very committed and we will not close our eyes to that situation. And I think it is time also for you probably to see these reinforced policies in terms of public health, and to make sure that now COVID is part also of these public health measures. And we will be happy. And also one of the point of the importance of this ceremony is not only the equipment that is going to be distributed, it's the fact that the NGOs like World Vision, but also others, are elements, are actors that really reach local communities. So making their work very interesting and very important for you, Minister, because they help you really to make sure that your policies and your decisions reach all the citizens of Somaliland. So I think I was very happy to hear you, and definitely very happy on behalf of the EU to continue our work together.
Okay. Minister, if you would like to add something to the ambassador's comment?
I just want to say, yes, I actually agree with him. You know, this virus is not going away. It will be circulating unless we get a vaccination, or unless we get a medicine for it. So it will be part of our national public health plans in terms of data collection, and in terms of trainings, and in terms of preparing everyone to to handle this problem in the near future. It's not going away. It's a new virus. It will be circulated. So actually, every plan we put will be based on that assumption that it will be with us, and we need to adapt every planning, every policy, and every intervention on this assumption. And I hope that that spirit will continue. And I once more want to thank you for that understanding. And inshallah, that will be our basic understanding of the current pandemic. And I think also every citizen will understand that this virus is not going away, and people need to adapt their behavior, their thinking, and their actions based on this assumption. And that is the only way we have out of this pandemic.
Thank you. Can I come in briefly also?
Yes, please go ahead.
Hello.
Hi, Tobias, go ahead.
Yes, thank you. Now, we understand, and it's true that the COVID-19 has really impacted on the communities, and the government is doing its best to support all the communities. It has also affected other activities, and some activities had really we have to find ways of how to do continue with other activities that we have been doing. Although we are concentrating on COVID significantly, we have not forgotten other projects that we've been implementing, and therefore other projects will continue, and we continually find ways of working with communities in ways that we're able to reach them. And with regards to COVID particularly, we have found that targeting the IDPs where people are overcrowded is critical. We also found that reaching communities in the rural areas is very critical, and working through our health facilities that we are supporting the government to work in are very critical, especially pre-screening and working with communities at very grassroots before they reach levels where they can contract the disease. Now, in particular, this project, we are going to be targeting over 10,000 people in Somaliland, and with the increase in cases that we have seen in Somaliland, according to WHO report, World Vision is continuing to raise funds to ensure that we work with the government and through the government to ensure that we reach the very areas that are very difficult to reach. We have launched a global wide response to support COVID-19. But even in Somaliland, we have also launched our own response, which we are supporting. And therefore, you will see our staff working very closely with you, linking very closely with you to ensure that we work through the government, but also we reach the most vulnerable people in the community. And therefore, we are very grateful for your support, and we will continue working with the government to support you effectively. Thank you.
Okay.
Yeah.
Fantastic. Thank you, everyone, for joining us for this live event. I would like to say a special thanks to Tobias Oloo for filling in for his colleague Simon at such a last minute, and also special thanks to Ambassador Nicolas Berlanga as well as Minister Omer. Thank you, everyone, for joining us. Have a nice day.
Thank you.
Thank you.